All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good evening. The groundwork of all happiness is good health. Welcome to yet another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib. It's typical to lose some hair every day as part of our daily life. Most of the hair will grow back and we will maintain a head full of hair. But in some cases, the hair loss is permanent and the lost strands fail to grow back. Today the topic of discussion is hair loss, causes and treatment. I know it's a very interesting topic and we have with us Dr. Rashma Thomas from Al Hilal Hospital, Hid. She is a dermatologist and let's move on to her and know more about hair loss. So doctor, welcome to the show.
Good evening. Good evening.
Thank you for being with us to discuss this topic, hair loss, causes and treatment.
Thank you.
So doctor, what are the possible causes of hair loss? Please explain for us.
Okay, the causes of hair loss is such a vast topic, but to understand better, I will divide the causes of hair loss, that one due to the loss of hair follicle, due to the hair thinning and hair breakage. So hair thinning is that which occurs in male pattern and female pattern hair loss, and hair breakage, it occurs due to inappropriate care of the hair. Okay. That is due to the repeated coloring of hair, straightening of hair, curling of hair, ironing of the hair. All these chemical treatments can damage the hair shaft and cause breakage. Okay, and the loss of hair follicle, many medical conditions can lead to loss of hair follicle. Of this, most common condition that we see is called telogen effluvium.
So doctor, now you mentioned about telogen effluvium. Yeah. Please explain for us.
So telogen effluvium means loss of telogen hairs. So what is this telogen hair? So to understand better, we can divide that every hair on the scalp, it passes through 3 stages of hair cycle. One is anagen phase. It lasts for about 2 to 5 years. Next is catagen phase, and the last telogen phase. For 3 to 4 months it may last. Okay. So on the scalp, 80 to 85% of hair will be in the anagen phase. Only 10 to 15% in the telogen phase. Okay. So when there is a stress in the body, many of the anagen hairs will be converted to telogen hair. So it will rest for 3 to 4 months and it will be shed from the body. Okay. So it can be understood better, like in females following delivery, after 3 to 4 months after delivery, they may complain of excessive hair fall.
Yeah, yes.
Okay. This is because the hormones that were there during the pregnancy period, when it comes to a normal level, it can't be retained. The hair can't grow without the hormones and it will be shed from the body after 3 to 4 months. Okay. So whenever any patient, when they present with hair follows, we ask a detailed history of any stress, mental stress, any exam stress, any history of severe infections like dengue, typhoid, or any sudden weight loss, crash dieting. Okay. We need a detailed history of 3 to 4 months back. Okay. And this telogen effluvium, it can also occur in those with thyroid disorders and in those with PCOS, and even some medicines like antihypertensives, that is medicines needed for blood pressure, even medicines needed for blood thinning, oral contraceptive pills, isotretinoin, all these can cause hair loss. And last, the nutritional deficiencies, deficiency of iron, vitamin D, vitamin B12, zinc, protein deficiencies, all these can lead to telogen effluvium. Okay. So in most cases, telogen effluvium, it will spontaneously remit by itself after 3 to 4 months, but in some cases, it may last more, and that is called chronic telogen effluvium. Okay.
So doctor, when we talk about hair loss, we always hear the term alopecia.
Yeah, yes.
So can you make it clear for us?
Okay, so alopecia, it just means hair loss. Okay, there is something called alopecia areata, in which one may note like hairless patches on the scalp, on face, even on body, without any itching, without any signs of inflammation. So that is actually called alopecia areata, but many people, they refer alopecia areata as just alopecia. Okay. So it is due to the destruction of the hair follicle by body's own immunity or body's own antibodies. Okay. It can be seen in those with thyroid diseases and those with eczema. Fine. So, and the treatment depends upon how extent is the alopecia areata is there. If it is a single lesion, most people respond better with just steroid creams, or more better with intralesional steroid. What is it? Intralesional steroid means we are injecting steroid into the hairless patches, if on the scalp or the scalp, if on the face, on the face. Okay. Don't get scared with giving steroid. Don't get scared with steroid injections and all. The side effects of the steroid injections into the lesion are very less than compared to steroid, than we are taking the steroid tablet or injection steroid inside, steroid through the veins and all. Okay. So, and other options include, if not responsive to the topical measures and all, we may have to go for oral steroid tablets or other oral immunosuppressive medicines. Okay.
Okay, doctor. Now, we know that dandruff causes hair fall.
Yes.
So, what's the connection between dandruff and hair loss?
Yes. For that, what is dandruff? Dandruff is just scaling of the skin of the scalp. Okay. So, mild dandruff is normal. It's physiological. No need of any treatment. Just use mild shampoo. It won't cause hair loss. But there is something called severe dandruff, where we see scaling of the scalp and scaling of the eyebrows, eyelashes, sides of the nose, back of ears, beard area, chest, back and all. So this severe dandruff is actually called seborrheic dermatitis. It can cause itching, redness, flaking of the skin. Okay. And this inflammation itself can cause hair loss.
Okay. Doctor, can you explain the male and female patterns of baldness? What is the difference between the male and female patterns?
Okay. So, both male pattern and female pattern hair loss, it means what occurs is there is progressive thinning of the hair follicles. That is called miniaturization of the hair follicles. The hair follicles are becoming smaller and smaller. Okay. So the presentation will be entirely different in males and in females. In males, there will be thinning of the scalp more over the vertex and the frontotemporal region. But in females, the frontal hairline will be retained, will be preserved. There will be more thinning of hair over the top of the head. Some females, they mostly present with increased thinning and visibility of the scalp and increased visibility of the parting of the scalp. Okay. And in males, the lower back of the scalp, the hair over the lower back will be completely preserved. Okay. Whereas in females, there will be diffuse thinning of the hair over the entire scalp. Okay. And both these cases can be treated if the treatment is given at the earliest. Okay. It's completely revertible.
So, doctor, we know that heredity also plays a role in hair loss.
Yes.
And how is it? Can you explain it for us?
Heredity plays a role, especially in male and female pattern hair loss. Okay, it's just not heredity that influence a hair loss. There are many other factors like environmental factors, including stress or medicines can contribute. Even hormonal factors can contribute these type of hair loss. Okay, the studies shows that the hair follicles on the scalp in both male pattern and female pattern hair loss, they are more sensitive to male hormones. So when a female, when they present with female pattern hair loss, we have to look for whether there is any other signs of male hormone excess in the body. That means we have to check for any signs of acne, increased acne, irregular periods, or facial hair. All this had to be done. And sometimes we may ask the patients to do even the hormonal test, the testosterone, male hormone, DHEAS, etc. Sometimes we may order even the ultrasound scan to know whether there is a male hormone secreting tumor, etc.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
We would like to know more about treatment options of hair loss.
Okay. In case of male pattern and female pattern hair loss, topical minoxidil and oral finasteride, which is a male hormone inhibitor tablet, these are the mainstay of treatment. Okay. So topical minoxidil, it gives excellent response in early male pattern hair loss and female pattern hair loss. Okay. And in females, in order to prevent the action of the male hormones, we may give cyproterone acetate, spironolactone, finasteride. These are the tablets which inhibit the male hormone action. Okay, in males along with minoxidil, we may give finasteride, which is a male hormone inhibitor tablet, but in a very low dose, 1 milligram. In early male pattern alopecia, minoxidil with finasteride 1 milligram, we get excellent results, wonderful results. Okay. And along with minoxidil and these hormonal inhibitors, we can also provide PRP. So what is this PRP? We all know it's called platelet rich plasma. and it is taken from patient's own blood, then it is gone for centrifuged. The growth factors are separated, it is injected back to the scalp, and with a single injection, it won't do any wonders. Multiple injections has to be taken, multiple sessions, like it's usually done every month, 3-4 sessions are needed to get good results. And there are no side effects for PRP except for a little pain, but that also can be handled by proper application of the anesthetic cream. And the other modalities include low level light therapy. It is like light therapy is given 2 to 3 times in a week. Okay. And if the patient is not responding to all these measures, or if there is total loss of hair follicles, then we may have to go for hair transplantation. So even if we opt for hair transplantation, in males there should be well preserved hair over the back, but in females, since there is a diffuse thinning of hair, it gives better results in males than in females. Okay.
Now,
But even those who opt for hair transplantation, minoxidil and PRP will be advised to be continued. Okay.
Doctor, can you explain about minoxidil in detail for us? And any side effects are there for minoxidil?
Yes, okay, fine. So minoxidil is a baseline treatment for male pattern and female pattern hair loss. Okay. So what is this minoxidil? Minoxidil increases the blood flow to the scalp. It increases the nutrient supply to the scalp. Okay. It converts the thin hair to thick hair. But the problem with minoxidil is, to get any good results, we may have to wait for 3 to 6 months. Okay. So the first 1 month after applying minoxidil, one may find increased hair loss. But don't worry, don't panic. Wait for 3 to 6 months. Good results will be obtained. Okay. And regarding the application, we know it has to be applied 2 times daily. There are different formulations of minoxidil. It can be in the lotion form. There is another called minoxidil foam also. Different concentrations are available, 2%, 5%, 7%, 10% are all available.
Okay. So apart from the side effect that it has to be used lifelong, any other side effects are there for minoxidil?
Yes. Fine. So minoxidil, many complain with, the most common complaint we get with minoxidil is that it can cause rough hair, sticky hair, thick hair and all. Dry hair. This is because of the alcohol content in the minoxidil lotion. It forms a coating on the hair. So this can be corrected by changing the formulation of application type of minoxidil. Rather than using the spray, we can use dropper to apply minoxidil. So this can be applied directly to the scalp rather than to the hair. And some may even complain of irritation on applying the minoxidil. This is also due to the alcohol content. So from the lotion form, we can change to foam preparation. There is another preparation of minoxidil that's called minoxidil foam. We can use foam preparation of minoxidil. If even after applying this foam preparation of minoxidil, if one complains of itching, then we may have to use with lower concentration of minoxidil. But even after using lower concentration, if again itching, we may have to stop using the minoxidil itself. Okay. And some even complain of headache, but that is usually transient. Most patients, they tolerate with repeated usage of minoxidil. The headache will be better, will disappear. Okay. And other side effect that we see is increased facial hair growth in females. Okay. So that is due to the improper application of minoxidil that can be prevented. Okay. So in females, when we apply minoxidil, it is always advisable to wear a hairband. Okay, this will prevent the minoxidil from trickling down on the face, okay, and the ear and all. So it's always advisable to wash the hands, face and ear after applying minoxidil. And in females, we always advise to apply minoxidil at least 2 hours before going to sleep. Otherwise, it will form a clot on the pillow. From that, it can cause facial hypertrichosis or increased hair growth on face. Okay.
So doctor, before we wrap up, what is your takeaway message for our viewers?
Fine. So always be gentle with your hair. Make sure that we are taking good balanced diet, including proteins, vitamins, micronutrients. Okay. and it's normal, it's physiological to lose 50 to 100 hairs per day. But if we note a frontal recession of hairline, or if there is much visibility of the scalp or thinning of the hair, it's better to see a dermatologist, because earlier the treatment, we can slow down or even reverse the progression of the hair loss, and so thus we can regain our self-confidence, our self-esteem. Okay.
Okay, thank you, doctor. Thank you for being with us and discussing about this topic in detail. Thank you once again.
Thank you.
So viewers, losing hair can be upsetting. If your hair loss is causing you distress, do seek medical help. Stay happy, stay healthy. Till we meet again in yet another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. This is Jessila Mujib signing off. Good night.